Hello, I'm Dr. David Spraggett. I'm a GP from Castle Medical Centre in Kenilworth and have been doing the job now for 36 years.
Hello, I'm Joanne Finney and I'm a trustee for Grapevine Trustee in Warwickshire, and that's been going on for 26 years.
You've got some questions for me, Joanne?
I have, yes. So, what is the COVID-19 vaccine?
The COVID-19 vaccine is actually an injection, and for it to work you'll need 2 injections, and those injections will be somewhere between 3 and 12 weeks apart. The other thing that's important to know is you will probably have the same type of injection each time.
Okay. Why should people have it?
Well, the vaccine will reduce your chance of becoming very unwell. In fact, it almost removes your chances of becoming very unwell from the disease, and it'll stop you going into hospital in most cases if you actually catch the disease. The other thing is it also reduces your risk of catching and passing on the disease. So it's really important to have it.
It was made quickly. Is it safe?
Right, the vaccine was made very quickly, but actually all the tests that were done were not rushed. The vaccine was also made in a way that had been used for quite some time before, so in most cases we understood how these vaccines work. The experts have decided that it is actually safe and it works really well. I think the other thing that people worry about is whether the vaccine has things in it that might make you ill. I mean, there may be a few people who have allergies to the specific components of it, but that's very, very unlikely. There's some important things that it doesn't contain, and that's things like eggs, animal products, and gelatin.
Can I have it if I have other conditions, sensitive skin, or if I take other medications?
Yeah, very definitely you can. The incidence of true allergy reactions to these vaccines is extremely low. I think if you're really worried, you should speak to your own GP to actually have those explained. But in the vast majority of cases, there is no risk. It's also important to say that at the time you have the injection, whoever gives you the injection will ask you these questions again. So there'll be 2 opportunities to make sure that all these questions can be answered. One of the things that would cause your vaccine to be delayed was if you actually had COVID-19 infection. And if you do, you have to wait 4 weeks till you can have the vaccine. But you should still have the vaccine even if you've had COVID-19 infection.
How do I get an appointment?
Well, appointments come in a number of ways. You'll either get a text message, which is the commonest way that your practice might contact you, inviting you to an appointment. You may get a letter, which is also would ask you to make an appointment. And then at that time, you'll be told when and where you have to go for the vaccination. It's unlikely to be your own general practice premises.
What happens after I have had the vaccine?
Right. Well, at the time you have the vaccine, you will be given a vaccination card, which will actually detail which vaccine you had, because there's more than one vaccine we're using. It'll also put the date, and indeed it'll put something called the batch number of the injection, which so that we know exactly which box it came out of, should there be any issues. So the other thing is that, you know, it will also be necessary for you to wait for a short while for one of the vaccines in particular, in case you have an immediate reaction. And it's the one that's called Pfizer is the one people are waiting 15 minutes afterwards. So wherever you go for the vaccine, there will be a waiting area where there'll be people actually supervising if people have problems.
How much does it cost?
It costs the patient absolutely nothing. The government and the NHS has purchased all of these vaccines. It should never cost you any money. If you have anybody actually communicate with you offering you the vaccine but asking you to pay, you should decline it, because that is not allowed. There is nowhere that actually provides the vaccine and except through an NHS situation like a general practice surgery or a vaccination centre.
What are the side effects?
Well, all vaccines and vaccines in general do have side effects. I have to say the commonest that we see is the sore arm, which actually is similar to flu or any other vaccine you may have had. Some people feel a bit tired and fatigued, and a few people get a raised temperature for a short time. It's really unusual for these things to go on for more than a couple of days. And that's, on one level, is a good sign, because it actually means that the vaccine is actually making your immune system work hard. So actually, if you have some of these side effects, it suggests the vaccine is doing its job properly.
Are these myths and conspiracies true? It might mean people can't have children, as it makes you infertile.
Right, there's absolutely no evidence whatsoever that this is true. Not only that, there is no way that these vaccines could do that to you. So I can say beyond doubt there is no connection between fertility issues and any of the vaccines that are currently in use.
They have put a location device in it. Is that right?
Yeah, this is a commonly sent out myth on social media. Again, there's absolutely no truth in this whatsoever, apart from the fact, why would you want to do it? There is no means for this particular injection to actually put anything into your body that would allow you to be tracked.
They have put a location device in it. Is that right?
That is even more ridiculous than the first concern. There is absolutely no way that anybody is being tracked by these injections. There is nothing being put into the body that would allow it to happen.
It causes additional growth in the body, like cancers. Is that right?
Right. Well, that is completely wrong, and indeed that's one of the things that was looked at in all the trials that were done before it was allowed to be used, and there's not been any associated cancers or anything similar with any of the vaccines that are being used worldwide.
Does it change the person's DNA?
No, that's an impossibility because of how the vaccine works. It's slightly complicated to explain, but there's no way that the vaccine would alter your body's own DNA.
How much does it cost?
Well, the vaccine is free to all patients. It's not available to anybody other than through the NHS. So I think it is really important to make clear that if somebody offers you the vaccine but suggests you have to pay for it, you must actually decline, and ideally tell somebody about that, because in fact that's a criminal act. So there's nobody should actually be paying for the vaccine.
If I don't have the vaccine, will I be banned from travelling or going to places?
Well, that's not something that we can be certain of at the moment, because government makes that decision, but it is really quite likely that in time everybody will be allowed to travel wherever they wish. It's probably true to say that in the short term, then there are going to be some countries that you would not be allowed to travel to if you didn't have the vaccine, but that's in the gift of the governments of those countries.
If I don't have it when I am offered, but change my mind, can I get it at another time?
You very definitely can. There is an opportunity to have the vaccine whenever, if people have changed their minds. There's more and more vaccine being given at the moment, so it's much easier now than perhaps it would have been a month ago. But many people have been invited more than once, and certainly those in the high risk groups, and that is people with some disabilities, will be asked more than once if they don't actually attend for a vaccine.
What do I have to do after the vaccine to stay safe?
Well, actually, after the vaccine, although, as I've said, the vaccine protects you from getting the infection, it considerably protects you, it doesn't work 100%. So the same sort of rules apply as applied when you haven't had the vaccine, in that keeping what's called social distance from other people is sensible, wearing a face mask in all enclosed places is sensible, and of course washing your hands frequently is also very helpful, and indeed it stops you getting many other diseases as well.
And thank you for your time.
Thank you.